What does the end of the COVID-19 public health emergency mean for you? The Office of Developmental Disabilities Services, or ODDS, has provided a guide for those receiving ODDS services and their families. Hello to Oregon's intellectual and developmental disabilities community. We at the Office of Developmental Disabilities Services have an important announcement. The COVID-19 public health emergency, or PHE, will end May 11th, 2023. Some things are changing, and we want to help you through these changes. We know that change can be stressful, and that some people have never received ODDS services outside of the pandemic. We're here to help guide you as we move forward in the next chapter of ODDS services.
Please prepare for these 5 changes, and you'll be on your way to being ready for safe, in-person services and supports to help you live a good life.
Change 1. Prepare for more in-person meetings. Starting on May 12th, some virtual meetings will now be face-to-face, including renewing your annual Individual Support Plan, or ISP, a face-to-face observation with an Oregon Needs Assessment, or ONA, assessor.
Change 2. Written or electronic signatures will be required. Written or electronic signatures will be required for documents like your ISP. Verbal agreements will no longer be used. You can sign documents by hand during meetings. And for remote meetings, you can mail or email them to your case manager. DocuSign for electronic signatures will be available soon.
What is DocuSign? DocuSign lets you sign ODDS forms electronically. ODDS is working with DocuSign to make electronic signatures available on all our forms. If you have questions, email odds.docusign@odhs.oregon.gov. Change 3. ISPs can no longer be extended beyond the plan year. After May 11th, ISPs must be renewed each year. They can no longer be approved or changed retroactively after the PHE ends. Change 4. Reporting positive COVID-19 cases to ODDS is no longer required. Providers must still report positive cases of serious contagious diseases to their local public health authority. Local public health authorities will advise providers if there is a confirmed outbreak of COVID-19 in 24-hour residential or foster care homes. Change 5. Parents can no longer be paid providers for their minor children. The Oregon legislature is considering options to allow parents of children with specific needs to be paid caregivers. If a bill passes, there will likely be a gap between the end of the PHE and any new program for paid parent caregivers. A new program would likely be different from what was tied to the PHE. ODDS recommends that you continue working with your services coordinator or personal agent to find other providers for your minor children. What is staying the same? Summer hours for children may be used during the school months after the PHE ends. ODDS will let you know before this changes. However, use of attendant care during remote school activities must end with the PHE. ODDS understands that some of the flexibilities during the PHE were helpful. Where possible, we are working to make some of those changes permanent. If you have questions, contact odds.questions@odhs.oregon.gov or contact your services coordinator or personal agent if you need more information and support. They can help you plan for what comes next. Thank you to everyone for your flexibility through the last few years. ODDS will continue to do our best to communicate policies to support you through this transition. Please join us as we work together to help individuals with disabilities and their families live rich, full lives. Thank you, Oregon's intellectual and developmental disabilities community.